Sir, I appreciate this legislation, and having lost a loved one during COVID and have only been able to say goodbye over sort of FaceTime, I can understand what you're getting at with this legislation. But my deep concern here is that it is, in essence, preempting what could be a very devastating and difficult time for this state and for this nation with this legislation without thinking about what the medical implications of the decision would be. If you will remember, during the pandemic when we were limited to visiting our loved ones, it was in an attempt to prevent people from bringing the disease into the hospitals. It was an effort of public health and public safety that those decisions were made in our state and also at the federal level. And what you have here in your legislation in subsection C just particularly bothers me. That it says the visitation rights specified in subsection A must not be terminated, suspended, waived, or otherwise limited upon the declaration of a disaster or emergency by the governor or the governor's designee or another individual or entity acting on behalf of this state or political subdivision of this state. If, my colleagues, we are in a situation where the governor is calling a declaration of emergency, then we need to ensure that we are doing all that we can to preserve the health of our constituents, which may include that folks won't be able to see their loved one on that particular day or at that particular time. And by having legislation now, while we are not in a state of emergency, we are binding the hands of the governor, whomever he or she may be or they may be, and we are not taking into account the real consequences that could be happening with medical care for people in our constituencies and in our communities. And so while sponsor, I believe I understand the intent of your legislation, I believe that it is a little bit too short-sighted in what it is seeking to address. And for this reason, I will not be able to support your legislation. And I ask my colleagues that you think about the times where we have been in a state of emergency or future times, whether an earthquake happens or there's another virus or something like that that we're dealing with. We do not need to hamstring the ability of the governor or others to prioritize the health of the people who are most vulnerable in our state. And so for those reasons, again, I ask that you do not support this legislation moving forward. Thank you, Mr. Speaker.